Hey, I'm Colton. I'm just going to be talking about my capstone project. I'm not going to show up ID right now, but I'll fix it for the final draft or whatever you want to call it. Alrighty. So I kind of introduced my overall capstone project. I just kind of give some more context. So I work in an ICU right now. I work with a bunch of veteran nurses that have been there for decades. And that's just kind of where I'm at. I'm just the new guy on the block, essentially. So looking at an idea, an opportunity to do a capstone project on my unit, it was a lot harder than I anticipated. Realistically speaking, you have the veteran nurses that have been there for a long time. They're going to be really stubborn. They're going to kind of be set in their own ways on how they do things, and they don't like change. At least on my unit, they don't want to change how things are being done. And so I imagined anything that I would try to do that would directly affect how they do things, I was going to get a lot of pushback. So it was pretty difficult to kind of think of something that I could minimize pushback but still allow to do my project. So with that being said, I initially started looking at our survey scores. So for our hospital, we have just a general survey that patients will take after they get discharged, and it'll just ask questions such as like, were they satisfied with their care? Did they feel like they were being heard? Just things like that. And so with that being said, I targeted on just patient satisfaction scores. So our scores have been declining over the course of a few months, but nonetheless, they were still in good standing. They were still above our goal rate. And so I wanted to target on those because I see the overall decline, and looking forward, it would just be keep dropping. So I wanted to see if I could target something to help fix that. And so with that, I targeted mainly on that survey, the different kind of questions, and I realized a lot of those questions could be related to shift report or shift change. And with that being said, the questions, kind of like what I mentioned before, are is the patient being heard? Do they understand what's going on? Is the nurse listening to what they have to say? And just other similar questions around those lines. And so with that being said, I wanted to target on shift report directly. With our unit, we are very lax on how we give shift report. Typically, I think the gold standard is you go in the patient's room, you talk about everything, trace lines, everything like that, and then you're all done. You pop back in later. Whereas my unit, we just kind of do the whole deal where you just sit at the computer outside the patient's room, you just talk about everything really quick, and then you go in the patient's room, take a quick look, say hey, then that's it. So with that being said, I'm sure there's a lot of opportunity there, that there are things that we're missing. And so I wanted to focus in on that and just hone in on seeing what can I do to kind of fix that. And so I chose this idea initially because I could see shift report being a big thing that does affect our patient satisfaction scores. You get involved with the patient, you're going over care, so it makes the patient feel like you know what's going on. It makes them feel more comfortable what you're doing, and also allows them to be more in tune with your care, because oftentimes you can hear a patient, they'll be talking to their family member, and the family member will be like, oh, why are they doing this? And the patient will be like, oh, I don't know, they're just doing it. And so with that being said, it's like the patient should be very involved with their care, knowing everything what's going on. And so I think bedside report is the opportunity to be doing that. I'm sure there'll still be little things within the gaps that happen throughout the day, but bedside report should be giving you like the outline for the day, if not just the whole hospitalization itself and just anticipated outcomes. So with that being said, I needed a mentor that would allow me to kind of get through these stubborn veteran nurses to help me just make my message being heard, essentially. And so I chose my mentor. His name's Riley. And so Riley's been an ICU nurse for a little bit less than a decade. He's bounced around from different hospitals. So he's kind of got like a wide variety and just range of how other hospitals worked and what works and what doesn't work. And so I know the nurses look up to him. He's a house supervisor. And so I know I could kind of get some leverage on my side with him. I also chose him because we also think similarly. We think like-minded things. There's things that we don't like that we also agree on. So it kind of made it super easy for us to mess and just kind of pick on certain things. And so that's why I chose him. So with that being said, I knew he could help me just pick ideas that maybe the nurses would be more open to, or just find a way to present the information of my project to be more appealing to them. So as far as my project and doing everything, the goals were to prepare and adapt to any potential barriers and pushback when introducing the project. So, ideally I'm a new guy. You got people that have been doing traditions, they're getting a little bit more stubborn. And so I knew I was going to get a lot of, pushback like, why are we listening to the new guy? Why are we doing this? Everything's just fine. So I was just, expecting that into my project. And then also one of my goals was just to see any sort of improvement in just the patient satisfaction scores over the course of the couple months that I did the project. It could be 1% and I would have been satisfied. And then I also wanted to be able to see that there was a positive trend, to see the longevity of the project. The surveys that are given are going to be, if the patient fills it out. So not everything's going to be filled out. So you might get, one patient a month that will fill it out, even though you see dozens of patients. So it's just going to be kind of something that will take course over a long period of time, and you'll be able to see those scores. And while I work there, I can still, manage to see the scores and kind of see what sort of outcome I provide. So to kind of analyze the project as a whole, there was some issues I encountered, kind of as I briefly touched on before. The veteran nurses, they weren't very too open to, this new way of doing things. They're like, what we do is fine right now. What do we need to change? And so I kind of had to talk with Riley about this, because he's kind of like a bigger dog, I would suppose, of the hospital as well. But he just kind of told me he would work with them. I just kind of had meetings. I just had to get on a level with some of the nurses, just like, even like, hey, like, I'm just doing this just for a couple months. Like, if you do this for me, it'd really help out. And so I was able to kind of do that. I think there was maybe one nurse that was just so reluctant to try doing this for me and the project in of itself. So the results are probably a tiny bit skewed, but nonetheless, it's going to be over a long period of time where you'll see the true and accurate results. So I just kind of had to keep, pushing, doing my project, making sure we are doing bedside report in the rooms rather than just outside like we have been. And so kind of as a schedule, really it was kind of easy as far as what I needed to plan doing. I just needed to kind of get my project out there. I kind of present it to everybody. And then my game plan was check every week, like every Wednesday. And then I'll kind of see if any results had changed from the surveys that had been given. And then just kind of continuously throughout the project, I just needed to make sure everyone was just kind of adhering to doing the report. So it's kind of like a cop, if you will, to check in with everybody. And then at the end of the project, I was able to get good results. So I deemed everything as a success. So as my slide, my patient satisfaction scores when I initially started the project, they were at 66% overall satisfied with the care that they had received. And then the scores increased to 75% by the end of the project. And so looking from the different survey questions, it seemed like this was directly correlated with patient involvement with their care, patients being confident in the care that they're receiving, patients being, or at least knowing the care that they're receiving, and just their interactions with the nurse. So all these four things are very well directed to the bedside report in itself. So I deem this as very, very much a success, and you would be able to see the results over a longer period of time, given more data with the patients. And so I think the benefits to the unit of this bedside report, I think it helps both the patients and the nurses. I think it allows the nurses to kind of be more on a level with the previous shift nurse, and being able to get eyes on and seeing everything they've seen, as well as being able to answer questions if it so comes up, as well as being involved with the patient, making sure they're understanding what's going on. Oftentimes you'll see patients that they're just kind of there and the nurses are doing everything, not necessarily explaining everything. So the patients, sometimes you'll overhear them on the phone, on the speaker, and being like, well, I'm not really sure why they're doing this. And so then if you're in there, you're just like, what? Why did no one explain that to you? So it's nice to have that ability to explain everything to the patient, and just kind of what the game plan is for the rest of the day, or even just their hospitalization itself. And so then also I was able to notice on my leadership skills that I did have the ability, to overcome those challenges. And I was able to kind of prove myself to the unit that I was able to make some sort of change, even though as little or as annoying they may have deemed it to be, but I was able to show some sort of progress. And so since I would consider bedside report a small thing, I think this kind of gives me momentum and just the ability to understand that I can choose projects that haven't been, that weren't of substance really, and just kind of turn them into something. So that means if I'm able to have the chance to work on a bigger project, I'd be able to kind of, make bigger waves essentially. And so just kind of like I said, everything had been a success. So I was happy to see that with the work that I've done. And so I think just kind of what I sort of had mentioned before, this will kind of influence me in the future as far as taking like leadership positions, since I am a charge nurse right now as well. To just to be able to apply these and just being able to create opportunities if I'm not seeing anything. Sometimes, you're like, oh, everything in the unit's okay, I don't need to do anything. But really, I think if you just create and dive deeper into problems, or even just want to tweak things a little bit, I'm sure you'll see better results than what you'll anticipate. But yeah, that's everything.